Are tight chest muscles giving you problems that you don't even know about? Then you better watch this. Hi, I'm Dr. Joe DeMarco, chiropractor and owner of OcraMed Health, and today we're here to talk about tight chest muscles. Now, oftentimes people can have very tight chest muscles and they don't even realize it because they're not having any actual pain in the chest muscles themselves. The pain could be in the front of the shoulder. They may not be having any symptoms or pain in the chest area, but their chest muscles are actually wreaking havoc on their body and on their training, and they don't even realize it. So how can we tell if our chest muscles are tight? A couple things. One is just looking in the mirror at our posture. If you look in the mirror at your posture, if you're finding that your shoulders are severely rolling in, that's a good indication that those chest muscles, the pec minor and the pectoralis major, are tight and pulling on. In particular, the pec minor, which actually draws the scapula down and forward. So when that muscle builds up adhesions and gets tight, it's not unusual to have shoulders that are rounding forward like this. Now, so you can just tell just simply looking in the mirror. The other symptom you might be getting that you don't even think has anything to do with the chest is you could be experiencing some upper and mid back pain. And the reason being is as the chest gets tight and as we talked about it, it brings the shoulders forward. What's happening to the muscles back here? Well, if the shoulders are being rounded forward this way, these muscles are actually getting overstretched because they're under constant tension because the shoulders, instead of being back, are pulled forward from the tight chest muscles. These muscles get in a constant state of kind of elongation, and they have stress on them all day long from those rounded shoulders, and you start developing upper back, well, sometimes neck pain, upper back pain, mid back pain, and you can't figure out why. You keep massaging back here, and all you're actually doing by constantly massaging back here is actually elongating those muscles further when the whole problem is just from the chest muscles. And if we just all we need to do is get some release on the chest muscles. If the tight chest muscles are causing upper and mid back pain, the solution to that is after you release the chest muscles, we would strengthen the muscles back there with some retraction type of exercises. But that's for another video. Today we're going to show you how to, at home, do some release work on the pec minor and the pec major. Let's look at the anatomy first. So let's take a look at the anatomy. Let's look at the pec major first. There's actually two sections to the pec major. There's what we call the clavicular head, and the larger portion is what we call the sternal head. Now, the clavicular head originates off the medial half of the clavicle, while the sternal head originates off of the sternum, the 6 upper costal cartilages, and down lower at the external oblique aponeurosis, I should say. And then the muscles actually insert onto the lateral lip of the bicipital groove of the humerus and the crest of the greater tubercle of the humerus. Now, in contrast to that, the pec minor is a much smaller muscle and it's deep to the pec major, and it originates off the anterior surface of the sternal ends of rib 3 through 5 down here, and it actually doesn't attach to the humerus. It actually inserts onto the coracoid process of the scapula. The pec minor actually draws the scapula forward and downward, as we're going to talk about in a second here. So that's the anatomy, pec major, pec minor. All right, so there's the anatomy. So let's do some fascia release work at home. I'm going to show you how to do it so that we can try to loosen up this area. Common area, problem area, whether you're sitting at a computer, head and shoulders are forward. Over time, chest muscles are going to tighten up from being in this prolonged position of being in this rounded shoulder position. Also very common, athletes, as particular weightlifters, chest work. It's going to tend to build up the chest, tighten up the chest. You'll see a lot of weightlifters with these rounded shoulders. We need to loosen this area up. So let's do some fascia release work. Of course, working fascia release, I like to use Tai Chi balls. This is a Tai Chi ball from OcraMed Health. The texture of this ball is excellent for breaking into deep fascial adhesions, and as opposed to a round lacrosse ball, a tennis ball that's just going to stay more on the surface. So before we do any type of fascia release work, and this goes for anywhere in the body, we have to warm up the tissue. So in the chest area, I would recommend before you start doing some fascia release work, do some push-ups, do a few chest exercises with some bands, something to get some blood flow into the tissue. We never want to do fascia release work, stretching, like I said, any type of stretching or fascia release work on any muscle group without warming it up properly. So let's warm it up. Say we've warmed it up already. We'll warm it up a little bit more by just taking the ball and just kind of, with the other hand, just kind of going over the outline and the fibers of the pec muscles. So, going underneath the clavicle, just kind of rubbing that ball underneath the clavicle, then coming down to the sternal area here. I'm working my left pec, as you can see. So I'm going to go under the clavicle, I'm going to go down the sternum, and then I'm going to go under the lower portions of the pec, and then I'll bring my arm out a little bit, and I'm just going to kind of roll that ball in just all different directions just to stimulate blood flow. So I'll spend about, say, 60 seconds just kind of rubbing and gently rubbing the ball into the borders of the muscles and across the muscle fibers to get some extra blood flow into the area. First off, so let's do some work on that pec minor. You saw how the pec minor comes off the coracoid process of the scapula, goes into the 3, 4, 5 ribs here. So the tight pec minor will draw a lot of times that scapula down and forward. So a good way to do some release work on it is just take the ball and kind of count down, if you could, to about the 3rd rib, which is about here. And we're going to hold some pressure on that pec minor. What we're going to do is we're going to press in and then actually pull slightly down on the tissue. And I'm going to hold that in and down. And then what I'm going to do is I'm going to take my shoulder and I'm going to shrug it up and kind of bring it back. Just like that. And I'm going to do that several times on one spot. So I'm actually kind of shrugging it up. So just doing that, you'll feel the stretch on that pec minor. And then I'm actually pulling my shoulder blade back like that. And I'll do it a few times. And then I'll come down a little bit further. So if I started around rib 3, I'll get down to rib 4. Once again, I'm going to push in and pull down and get some nice firm traction as much as I can handle pressure-wise. I'm going to shrug the shoulder up and back. And you can really feel that release when you do that. Shrug up and back. And I'll hit 3 or 4 different spots into that pec minor. Do that for 3 or 4 different spots. And like I said, 4 or 5 times where you shrug up and roll back nice and slow. It's not a quick motion. Just find the spot, press in, pull down, shrug up and back, nice and slow. That alone, it feels excellent. When you get done just working the pec minor, you're going to notice it's just going to feel like so much more mobility and your chest is just going to feel looser. That's just from the pec minor. Here's how we're going to do the pec major. All right, so here's how we're going to get some fascia release with the pec major. We're going to need to lay on our backs on a bench, be off to the side so that we're able to drop the arm off the bench so we can get a good stretch through the pec major. Now, the motion we're going to be using as we drop the arm off is from this position. We're going to be dropping it off to the side, and as we drop off to the side, we want to externally rotate the arm. So it's going to be coming off like that. This would be internal, external rotation. So we want to come off and be externally rotating like that to get the stretch of the pec major. We're going to hit some different angles up in here. We'll come in a little lower that way. And so we're going to start in this position here. And from this position, we're going to take the Tai Chi ball. We're going to put some firm pressure. Let's start along the sternum area of the pec. We're going to put some firm pressure down. And what we want to do is actually put it down and pull in towards the sternum. So we're pulling the tissue in towards the sternum like this, so that puts tension on the pec fibers of the pec major. And then as we put pressure down and towards the sternum, we're going to actually be stretching it in the opposite direction as we drop the arm off, externally rotating. And you can really feel that release the pec major by doing that. Then we're going to come back up, continue to put pressure, pulling it in towards the sternum, and now drop it off at a little bit of different angle like this. Nice and slow, nice and relaxed. Let it drop off. Hold it for a couple seconds down like that. Come back up. Do several passes like that where you're stretching the arm off the table. Then come back up, and in this position, then change and move on to a different part of the pec major. Now, if you happen to find an actual knot in the pec major where it feels really tight and adhesive in there, you want to target that. If not, just go down the sternal area, as you put pressure, and then pull into the sternum and do some passes where you drop the arm off the table. After you do several going down this way, get up into that clavicular portion of the pec major, get down onto the right below the clavicle. Once again, put pressure into it and then pull towards the sternum. And once again, drop that arm off as you externally rotate. Nice and slow, come back up, come off at a different angle, and really put firm pressure down and in towards the sternum as you do this. You know, to whatever your tolerance is, it could be very uncomfortable, so just put as much pressure as you can. You see you're going to get some rending, and you might even have some marks on it later or the next day. That's okay, that's part of fascia release work. It's not a pretty sight, and it's not fun. It's something that, you know, it's a little uncomfortable, but it's worth the effort because it's going to break up any type of restriction and adhesion in the fascia, in the muscle, and it's going to increase our mobility and our range of motion. So we're going to work several spots here, get up on the clavicular portion of the pec major, and work along here. This in combination with the work on the pec minor, we're going to increase our mobility. The shoulders are going to come back, and we're going to really have much better range of motion and really help prevent any further or ongoing injury. Okay, so give that fascia release techniques a try on the pec minor and the pec major. Fascia release work, as I've mentioned 100 times before, isn't something that's just going to happen overnight. You have to be consistent at it, working at it every day, a little at a time. Over the next several weeks, you're going to start noticing a nice release through those pec muscles. You're going to notice those shoulders are going to be no longer going to be rolled forward, and you're going to notice a big increase in mobility through your chest area. So work that. You know, these are the type of little things we pay attention to at OcraMed Health when people sign up for our 90-day fitness program. So if you're interested in building lean muscle mass without the bulk, combining calisthenic and gymnastic movements along with basic heavy weight training, you definitely want to visit my website and sign up now, www.ocramedhealth.com. My ebook is also available on ocramedhealth.com. It's called The Accommodation Avoidance System. It's our ebook on how to heavy weight train without hitting plateaus on your major lifts and how to break through plateaus. So order that now through our website, www.ocramedhealth.com. If you're enjoying these videos, please subscribe to my channel, OcraMed Health on YouTube. Questions about injuries or exercises, just leave a comment in the comment section below. I always get back to everyone who writes in. And don't forget, OcraMed Health is here to keep you fit forever.